the University of Manitoba and a member of the CASN Research and Scholarship Committee. On behalf of the committee, I'm delighted to welcome you to this final session of the 2018-19 Lunch and Learn series. I'm sure many of us are familiar with the concept of Lunch and Learn, where faculty members come together during the lunch hour to share with one another projects they're working on and dialogue on successes and challenges they have encountered in their work. This webinar series is intended to serve as inspiration and a networking opportunity for participants while experiencing that collegial feel of the Lunch and Learn. In this March session of the 2018-19 series, we're very pleased to have a presentation from Dr. Linda McGill-Tall. By way of introduction, Dr. McGill-Tall is a Kathleen Russell Distinguished Professor and was the Associate Dean of Research at the Bloomberg Faculty of Nursing, University of Toronto, for 11 years, from 2007 to 2018. She has been employed as a faculty member at U of T since 2000. Linda is a recognized leader in nursing, health services, and systems research. Her research program focuses on health human resources and the nursing work environment, including the nursing staff mix, models of care, nurse retention, nurses' health, and patient safety outcomes of nursing practice. Her current work is focused on the implementation of the NCLEX in Canada. Linda's leadership in research has been recognized with the presentation of numerous awards, and I'd like to highlight a few of them. Linda was the first Canadian nurse to be inducted as an American Academy of Nursing International Fellow. She was also the inaugural recipient of the Canadian Nurses Association Order of Merit for Nursing Research. She was inducted as a Fellow of the Canadian Academy of Health Sciences, received the 2013 Research Mentorship Award from the U.S. Health Services Research Organization. And in 2016, Linda was named to the International Researcher Hall of Fame of the Sigma Theta Tau International Honor Society for Nursing. Her research has been recognized with several career awards, including an Ontario Ministry of Health and Long-Term Care Nursing Senior Career Research Award, a CIHR New Investigator Award, and a Premier's Research Excellence from the Ontario Government. CASN has also recognized Linda's leadership and research expertise, with awarding the 2011 CASN Award of Excellence in Nursing Research, the 2017 Pat Griffin Swaller Award, and in 2018 was named a Fellow of the Canadian Nurse Educator Institute. Congratulations, Linda, on your stellar record of achievement. During today's webinar, titled Building a Program of Research in Nursing Academia, Linda will be offering a practical guidance on developing one's own unique program of research, focusing on the program of research of nursing academic faculty. Linda has a PowerPoint presentation, which you will see on your screen. She's open to addressing questions during the presentation. As well, there will be time for further questions at the end of her presentation. To submit your questions for Linda, please use the chat function on your screen. Once you finish typing your question, just remember to click the send button. I'll now turn the session over to Linda to begin her presentation. Thank you, Linda.
Thank you very much for that introduction, Nita, and thank you to CASN for actually taking the leadership to offer these Lunch and Learn series. There's certainly, it's a great opportunity to share with people, and I've enjoyed them in the past. And I'm quite pleased to be able to do this session on building a program of research. And hopefully everybody can hear me fine. I think we tested it out before, but I'm assuming that we can, I can be heard fine. I'll start off the presentation now, and as Nita said, feel free to write in your questions. Anybody that has anything they want to ask as we go along. I will pause once in a while and ask people if they have questions, and we will certainly have time at the end as well. So thanks again for inviting me. I'm going to go to slide 2 now. And just the first thing I'd like you to do for yourselves more than anything is just take a minute to write down what you would say, a sentence or a point or two about what is your program of research and how do you describe your program of research. So just take a minute and think about it, and if you were to, someone were to ask you at a meeting, what would you describe about your own program of research? And we'll come back to it towards the end of the session and revisit that question as we go along. So when you look at slide 3, building a program of research. So part of what I'll cover today is what is a program of research? How do you determine the focus for a program of research? Why is it important or necessary to have a program of research? And if there's anything that you feel I don't cover, feel free to write in, and we'll try to add it on at the end if there's questions or components of that. Certainly, there's a number of online resources and a few articles, depending on the discipline, about what a program of research is. But there's one that I chose to use for a couple of slides today that is developed by Professor William Holzheimer from the U.S. He's a really well-known research scholar in the U.S. in the area of HIV outcomes research. And this is a relatively old article of a keynote address that he gave in Japan around building a program of research. But essentially, a program of research is an area that's of high interest to you as an individual, the person that's defining it, that you're going to build knowledge on over time. It might have a number of branches. Some people choose to make a visual diagram. Often when you're going forward for a tenure position, you might draw it out to sort of demonstrate to your reviewers how the little fronds or arms of your research look. Program of research addresses a significant issue that is relevant to the health or healthcare society. If you look at CIHR, they want all of your research to be relevant to the health of Canadians. SHRC is a little different, but essentially you're really picking up on developing a program of research that's addressing something that's important and significant. It's not about you navel-gazing or us navel-gazing and just thinking, oh, this is kind of something that would be interesting. It does have to have some significance. And it's really important for it to be grounded theoretically and methodologically. I mean, most of us have a leaning either one or the other, but you really will find as you're going forward to get research funding and also in publications, you do need to be able to demonstrate and articulate where your program is emerging from, whether it's a theoretical lens or whether you're testing a theory. And similarly, the methodology has to be very sound and valid. In Holzheimer's article, he talks about some of the essential characteristics that you need to have for a good research question or a good research program. It needs to be feasible. So is your program of research feasible? Can it be accomplished? Or are you being so, not necessarily grandiose, but is it so unwieldy that it's not going to be possible to do it? Is it interesting? Is it something that captures the interest of a reviewer, of a funder, and that is important enough to be done? Or has there been so much work done on the field that you'll have somebody say, why do we need another piece of research on job satisfaction of nurses in acute care, for example? So is this something that's really of interest? Is it novel and innovative? And that's something that we see a lot in Canada now, that you're expected to be able to tease out something interesting and new. So consider that. Is it ethical? And are the risks appropriate to the benefits of participation? Nobody wants to be supporting or funding something that isn't necessarily optimal. We don't want you tying people up in the basement or odd. Anyways, is it relevant? Is the program of research relevant to healthcare, to nursing, to patient outcomes, to cost, to what other variables are important to your funder or you in terms of research overall? So these are actually, when I was reflecting on it, even though this article is almost a decade old, it's very relevant still in today's world. And I just wondered if anybody had any comments, or do you, any points that anybody wants to make about that? Is this what you think of when you consider a program of research? Might be too early for people to kick in, and so I'll continue. The next stage of what I want us to talk about or consider are the building blocks for a program of research. And so I think one of the first things, I served as the Associate Dean for Research at the Faculty of Nursing at the University of Toronto for 10 years, and it was really, it's very important for individuals. Okay. Does anybody else see that?
Yes, there's interference right now.
Yeah, there's a little echo, Linda.
Is it my echo? Because it's not me. Okay. So now it seems to be gone. I haven't touched my phone, and it's just sitting there. So
Yeah, it's
I'm
gone.
okay too right now, yeah.
okay. So I think one of the things that's very important for everybody, especially if you're a faculty member, is to understand the expectations from your dean or director at your School of Nursing about what a program of research is supposed to look like there. Because it differs. It differs between universities. It differs between schools. It differs between countries. And that's one of the challenges when you try to look online and learn things about building a program. But when you start out as a newer faculty member, or if you're a postdoc or a PhD student considering going on into a faculty research role or a research scientist role, the most important first step is to really understand the expectations. You think you know something from the interview, you only remember part of it whenever you start, and things change. And so it's really important. And the little picture I have on the right is something from one of our research reports at the University of Toronto. University of Toronto is a university that follows rankings. Rankings and metrics are important to it. We are known to have a high ranking in terms of citations of our work and how the uptake of our research, how we're ranked internationally is important to us. And so for anybody starting a research career there, it's important to know that that's an expectation, and we want people to be able to help us sustain and maintain that ranking. Other universities are likely working similarly. I don't know how much language there is about that, but that's something that as a faculty member or someone that's considering a faculty position, it's very important for you to know that. And my experience has always been that it's okay to go back to the dean or director a few times and get clarity. In universities where you've got an associate dean or a director specifically for research, similarly, that's part of their role normally, is to help guide and support newer faculty around understanding metrics and understanding expectations. And so it's very important for you to know, as you're building your program, what are those outside expectations that you're trying to fit into there as well. Does that make sense to everybody? And then the other point I would make here is it's really important to talk to colleagues and colleagues at all levels of their academic career about the building blocks that they went through, how they went about doing it in terms of building their own programs of research. So one of the things that the new Associate Dean research at our faculty has done is she started they're kind of lunch and learn sessions at our faculty once a month. A faculty member presents their research. And that's part of what you hear them talking about, how they got to where they are, how it emerged. And so you really learn a lot about how somebody builds a program of research by attending sessions like that, but also by having one-on-one discussions. And in my experience, I find faculty are very giving in that way. They're very willing to share experiences. And essentially, they have a lot of knowledge that you can use. And, you know, I would suggest as well, you don't do it just once when you start or when you're newer in the faculty, but you really, on an ongoing basis, you have conversations with colleagues. And I don't mean colleagues just within your own organization. I think it's important to develop colleagues at other schools across the CASN network. They don't all have to be within your own province, but you're essentially trying to learn from your colleagues. We've all gone through it. We've all developed them. We're all at different stages in our career. And I find, and I think Nita would probably agree with me, that our colleagues are quite willing to give of their time. And it can be something as simple as going for a coffee, and I want to ask you about what's your experience been with SHRC. I see that you're on a SHRC team. You're on a SHRC grant. I'm thinking about submitting a grant to SHRC. And SHRC is the Social Sciences and Humanities Research Council in Canada. And so, for example, if you find someone that has an experience like that, you can go to them for that. Or you might just want to talk to a colleague about how it feels to be new and trying to develop this, and a newer colleague, what did you do? How did you go about doing it? So I thought I'd stop here for a second and see, does anybody have any comments or questions about any of this so far? I don't know if there's any questions coming up, Julia, that you see as you're seeing. That
I think someone, I see Nancy typing something in right now, I think.
Well, I might continue. Oh, wait.
Okay.
Go back. Do universities have a theme among the faculty? So Nancy sent in a question. Do universities have a theme among the faculty? I'm assuming you mean, like, in my case, I'm a nursing health services researcher. Is that the kind of thing you mean? And a theme of research. So certainly they can, but not all universities necessarily do. And that's a really good question. So you as an individual may choose to take an appointment at a university where there's other people. For example, at University of Toronto, we have one of the leading pediatric pain researchers in the world. Dr. Bonnie Stevens is one of our faculty members. And so she attracts people that A, want to do pain research and work with this stellar researcher that's known internationally, but B, want to specifically work within pediatric pain. So it is possible to, looks like this is advancing. This is really advanced, eh? It looks like this is just skittish. So universities may have thematic areas like that, but not all do. And so certainly several years ago at the University of Toronto, we had a health services research field where we had a very robust group of researchers. We have fewer people in that field now, just as we've had faculty turnover. And we have a very robust group that we call ECHO, Effective Care and Health Outcomes, and they do a lot of clinical outcomes style of research and clinical trials. And then we have a group that do critical appraisal, critical approaches to health and well-being, equity, and that kind of field. A lot of them do qualitative or realist type of methodologies. But all universities don't have that. And it isn't necessary, but you as an individual seek out to go to a university where you see people of like mind. It's not necessary, and for the most part, you don't usually end up working with people in your hallway or your university. When we talk a little later about building a team, it's really about finding like-minded people across the country or across the world.
So Linda, we have
another question that's come up.
We have a comment from Stephanie Bailey.
Sorry?
We have a comment from Stephanie Bailey. She's saying, I really appreciate the comment about the importance of connecting with colleagues. Sometimes we get so caught up on our own work that we forget about what we can learn from one another.
Yeah, and really echo that. It's so hard to take the time and connect with your colleagues, but I can't emphasize how important it is to build it in. And, you know, A, you need it because you silo mentally and you just get caught up in what you're doing. And B, it's really important. You want to learn new things. You want to get the best advice. You want to get all kinds of advice. You're essentially a sponge, and you are, I think, until you retire, because you're learning about everything. But it's so important. I mean, in a couple of places, I'm going to suggest you actually build this into your schedules. You build it in your online calendar that you're going to next week invite a colleague for coffee, or, you know, put this in your calendar to actually do it. So you ensure that you are building some of this contact in, because we can go into isolation. It's very easy, and many of us would say that. It's very easy to just work in your silo and just think your own thoughts, but you don't get reviewed by yourself. All of your reviews are by a team of people, a group of people, a number of people, whether it's for funding or whether it's for publication. And you always learn, and it's important to have a quality work life as well, and build your networks and colleagues. They'll help you, and you'll end up helping them down the line. So thanks for those questions and comments. Those are very good to get them. Building blocks. So I'll talk a little bit now about building your program of research. This is not doing what it's supposed to. So I've said already, you know, understand the expectations of the dean and the school. Talk to your colleagues. The other thing that's really important if you're in an academic position is to demonstrate that you've built on your dissertation topic or your postdoctoral research work and really show a common thread. At some point in time, you're going to go for a review of if you're in the Canadian system in an academic position, and go for tenure or promotion. And you need to, everything has to be linked, cohesive, and there's got to be legitimate building blocks. So you did X in your PhD, you moved onward from your PhD, hopefully, and extended it to this in your postdoc if you did one. And from that, now it brought up these questions and you're moving there. You're essentially going to need to create a narrative that makes sense. And so it's really important to always think of it that way. But one of the normal things to do, and a really important thing for you to do, especially when you're newer, is get those dissertation findings out there and get your postdoc findings out. You want to start to develop your name and get your name in this field of work. So people start thinking, oh, there's this person emerging in the area of pain research that's looking at it in a different way. It's really important that it's cohesive. So the things fit together, not the same, not necessarily in a linear manner. I'll do this and then I'll do that. But it really does need to fit together. You don't want a reviewer of a grant to say, where did this come from in terms of what the background says or what this researcher has done. Because part of what we review when we review grants is where you're coming from, your background, your CV, what you submit about yourself. So you don't start out studying cardiac disease and then switch into studying pediatric HIV without some kind of a logical explanation why you're doing a flip, and that's a pretty big type of leap to take. Often you do a series of studies that collectively build new knowledge, and this is really all about new knowledge. And it's not uncommon, like I gave the example earlier about job satisfaction in nursing. So it's not uncommon for me when I'm in grant review committees to hear somebody say, isn't this just another study of satisfaction with nurses? Do we need to do another study that looks at job satisfaction of nurses? And those are good questions that reviewers are asking when there's 40 or 50 years of research on a topic. You have to make the reader understand what's new about it. Why is your study going to be different? Why is this program of research important? And how is it contributing to new knowledge, what you're planning on doing? And remember that this is about you. It's your area of expertise. So you really are moving beyond your PhD supervisor, your postdoc, and it's going to be, it's not like the PhD, it's not like the postdoc. Those were the beginning buds of your research, but you get to leave them behind in a way. But this is the area that you're spending the rest of your career on. It's your life now. Your work and your life are all about X, whatever this is. And so it's something that's got to be of really great interest to you. Something that you're not going to say, I never want to see anything about nursing job satisfaction again, for example. Like you never want to look at another article. You can't move into something like that because then you just won't have the gumption to continue in it. You've got to be passionate about it and ready to commit yourself as an academic researcher to this broader area over time. And it's got to be something that's important, that's relevant and feasible. That's similar to what Holzheimer said as well. And so that's part of you articulating what it is. And these are things, if you've got a structure in place at your school or when you're out talking to your other colleagues that are doing research, ask them about this. Like ask them about how they made the decision to pick this select little area and how do they stick to it and how do they manage to not get, I'm not going to say bored with it, but tired of it, because you don't have the luxury of getting tired. This is really, if it's an important enough area, if it's relevant to the field, then, and you're passionate about it, you can maintain it for sure over time. Having trouble with these slides, sorry. Again, it's about you're trying to establish that you have the ultimate expertise in this area over time. So it's not going to be in 10 years or 15 years from now. it isn't going to be Bonnie Stevens at the Faculty of Nursing at the University of Toronto that is the leading pain researcher in pediatrics in Canada and nursing. It will likely be one of her emerging scholars that trained or educated with her that is taking it to a new level. And it won't be the same as the work she did. It's actually going to be something unique and specific that you can hang your hat on and say, this is what I'm known for. I'm the expert in this field. And the media can call you, and you'll be the one that can give the answer in a different way and to a new level compared to how somebody did it before. Your program of research needs to be broad enough to be cross-cutting. And by that I mean something that would be relevant. So originally I was looking at nurse staffing models in acute care hospitals. In my PhD dissertation, that's what I looked at. And that certainly in one of my later grants, I used a similar model, but I was able to take that into looking at nurse staffing models in a long-term care population. And I had home care folks saying, is there any way you can do research like this in the community as well, so we can look at, is there any relevance to that? So you're trying to look at something that can be applied in a more cross-cutting way, but you still keep this one thematic area that you're known about. But it needs to be narrow enough that it's manageable. So when I started out, I wasn't looking at nurse staffing models for every sector across the entire country in Canada. I only looked at acute care, for example. And so you do want to make it somewhat manageable or narrow enough that you can look at it seriously from both a theoretical and methodological lens. Is it fundable? That's the hugest part of all this. Once you articulate what you want to do, is this something that is of interest to funding bodies? Normally we say the big funding bodies like Canadian Institutes of Health Research or your funding bodies in your ministries or the Social Sciences and Humanities Research Council. Some nurse researchers are getting funding from the National Science and Engineering Research Council, the third of the tri-councils, so from NSERC. So really, you're getting familiar with what funding agencies are out there, what they fund, and does your work look like it's fundable and relevant in there? And some people are, we had a faculty member a few years ago when the Gates Foundation first started. They did a big innovation for HIV research, and we had a fairly junior faculty member at the time that was studying HIV research and was able to get one of the original Gates small grants because his focus was on that area that the Gates Foundation funded. So it is about learning what agencies fund what, and then how does your idea fit into that? It looks like I've got a question. I'm just going to make one more comment and then we'll go to the question. Your program, it's always important to be consistent with the faculty, school, or university goals or focus of research. So, for example, some faculties across the country have specific branches or arms where they have an international focus. Some have programs they offer collaboratively internationally and branch out that way. So sometimes the expectation in those places may be that you look for international funding as well, and the university might support that and the faculty might support that. So make sure that what you're trying to do, always in the back of your mind, you want to be able to be sure that what you're doing is a fit. It's not the same thing as the other faculty members are doing, but it is something that makes sense and is a fit. I think we have a comment or a question from Nancy.
Yes. She says, as a PhD student, we have our area of focus for our dissertation. How do we expand into other areas? We often see faculty with many interests.
Yeah, and that's a really, really good, very good question. And often what happens is your research findings, your research will start, your results will lead to another question. They almost always do. Or they uncover another area that needs to be studied. So myself, for example, I started off looking at the impact of nurse staffing. So my dissertation was around nurse staffing models and patient outcomes, and my first research grant was around that. And as I was looking at outcomes, the outcomes piece, I was clearly looking at patient outcomes, which at that time were not well articulated in the literature yet. But I'm interested in the nurse because I'm a health services researcher. So for me, I care about job satisfaction, job stress for nurses and that. So I became interested in what evolved into the language that evolved into being the nursing work environment and more around nursing outcomes. So essentially, Nancy, what happens is you often have a few prongs of research interest. So yes, I'm interested in staffing and I maintain that as a piece of research, but then you branch out and you look at something that emerged from your research, and for me it was the work environment of nurses and how that might be influencing outcomes for them, including their health and safety, and for the patient. And so that's how it tends to evolve. But you don't normally jump, as I said earlier, from one whole field to another whole field. But you will find that your research will demonstrate something that's a gap. And even if you end up with a dissertation thesis that has no statistically significant findings, if it's a quantitative study, you will find that there's something that's in essence, it's telling you something that in fact you probably needed to look at something a little differently. So there's always something out there, and I think any of us that you speak to will say there's always a question to ask. The challenge isn't so much about how to expand, it's about how to keep yourself focused. So by the time somebody's going for a third-year review or a pre-tenure review, we normally at our school tell people not to have more than 2 to 3 types of things that they're working on, because you could mushroom like an octopus, and it's on you essentially to try to create that narrative about what is it that I'm doing, what am I articulating about what I'm doing. It's not that you're doing every piece of research that's known to man, it's about the fact that you can really provide a linkage. And usually in your first 3 to 5 years, it's usually just a couple of strands or 3 strands at most, if that makes sense. But those are really good points and questions. Thank you. And we invite people to keep putting in questions or points like that as we're going along. And this slide is about how you're starting up in terms of funding and granting opportunities. So it's okay to start small. Again, go back to your dean or director or your associate directors or deans for research and talk about this. Make sure it's okay for you at your school. But normally we say it is okay to start small. So you might get just a $2,000 grant or a $5,000 grant at first. But those are all the building blocks. There's where you say, hey, I got it. I got this grant to do this particular project, and you use the findings from it to build, to go for the next one. You build on those successes. You often see people starting out doing pilot studies, doing knowledge synthesis, literature reviews, scoping reviews. Now a lot of scoping reviews and lit reviews are fundable, or they're often a part of the first stage of a grant. But It wasn't always like that from grant funding. It's like an essential building block, though, to developing a research question or a program of research. You need to know that there's a gap in the field, not just your brain thinking it. You actually need to look at the literature and determine that there is a gap. And so often, if you can get these types of things funded first, to demonstrate to a larger grant funder that A, you did it the right way, but B, you were able to get peer-reviewed funding for it. So that's huge. So now all schools may not believe that. Some schools might say go for CIHR, Tri-Council funding right away. But normally my experience in Canada so far has been that they, for the most part, support this building block approach where you put in for smaller grants to then build on that work going forward. The next component I'm going to talk about is building a team. And I think it's really important here to stress it's not about you being solo or silo. You're not working alone. You are doing, 99% of the work in your office or wherever you do your work on your own, but you need a team to do research. Very rarely does a single individual get grant funding research. It isn't about just you. It's about you getting good collaborators beyond your doctoral and postdoctoral supervisor. It's about you emphasizing that you're independent of your supervisor. You often do continue to work with your doctoral supervisor or postdoctoral supervisor, but you'll find once you start branching out, there's like minds out there. There's somebody out there that thinks like you think, and you might meet them at a conference, you might meet them at a meeting, and you might think, hey, that's neat. I'd like to work with this person. I like how they think. And so you ask, and you just start building those relationships. There may be somebody in your field that you think is particularly great, and you reach out to them, and you start seeing what it's like to work with them. You need to actually have those collaborations to get grant funding, not necessarily when you're doing something initially in a smaller lit review or something, but even then you do want to have people that you're working with. And you also want to develop partnerships with partners that are in clinical academic settings, the community, home care, wherever you're working, that are clinicians, that are policy leaders or decision makers in your field. It's very uncommon for somebody like me, for example, not to have a nurse leader or a policy maker on research that I do. I would just engage them. Similarly, in clinical settings, it's almost never, it's so common now that people actually do engage a patient as well as the clinical academic leaders in their research grants, and write on them and really as a co-investigator. And so it's really about taking the time to build this team. And you're also collaborating and working with students. And so you're starting to build a team that includes and incorporates the next generation of research scientists there with you. And that might be, at our school, we have everybody right down to an undergrad student involved in research. We run an undergrad summer student program, and they work with researchers. But, you, as a tenure stream faculty, you do need to, at some point in time, normally start potentially supervising doctoral trainees or postdoctoral trainees. So you do want to look at ways of building them into your grants, working with them, supporting them, and engaging with students as you build your team. I really believe, and I think in this world and day and age today, you have to embrace both quantitative and qualitative methodologies and team members. It's very, very common at the granting councils, other than possibly for clinical trial. I don't review them. But it's really common to see mixed methodologies or multiple methodologies used now. And it's also really important to be respectful of both. We can't be in silos. Both of these are very, very tried and true methods. They're very well accepted. and there's a richness to both of them. You may have a quantitative lens mainly, you may have a qualitative lens mainly. Either is great, but it's really becoming common to see people add collaborators or colleagues on to bring both together. So you might be doing a trial where you need to do interviews first, and you might not be someone of an interview style brain, so you'd bring a fellow on, that a colleague on that can provide that for you. And I think it's really important to instill that thought as from the very beginning of your careers, and recognize the importance of it. Nobody expects you to be an expert in both. You're usually an expert in one, but it's quite important to respect both and to look at embracing both methodologies. So I just wondered if anybody had any questions about building your research team. Often people do want to ask or have specific things to ask about how to go about doing it. I don't know if I covered it well enough, but if there's anything, feel free to ask questions. I don't see anybody writing anything, but feel free if anybody wants to ask. It does take some work to build a research team, but again, my experience has always been surprisingly positive. How big should a team be? So Nancy has put in a question saying, how big should a team be? It's, you know, it depends, and it's about the scope of your research and your question, and it often comes to you as you're developing it. So if you're finding that you want to do something where you want to use multiple methods, you would want to have somebody that has the other methodology. You may want to have a senior scientist on it that has particular expertise in the area. They can help you articulate some of your understanding about how to use or apply a particular model, because they've done that in their work before. They also maybe have brought funding. So I think there's a real range, but it's, you know, anywhere from 3 to, I'm not going to say infinity, but there's, when you get further on in your career and you're building the really big foundation type grants, sometimes there's very, very large teams that are involved. So there is no magic number, but it's very unusual to just see a solitary person get funded as a single person alone. And it's usually more that you bring in people with the expertise around a component of what you're going to study. A colleague of mine at the faculty at the University of Toronto just put in a project scheme for CIHR, and we went outside of the discipline to add somebody in that had a particular expertise in that sector, healthcare sector, and had good funding, but was also using interesting methods in terms of how they were approaching subjects and the instruments they were using in that particular field. So a number of things around your research guide you, and one of the things about working with more than a couple of people on a team is it's really common for us to say, hey, you know what, I've seen so-and-so at Dow is doing something on that. You should look them up and see, and maybe they'd be interested in joining this team. And so that's kind of how you do it. Most of the time people will join in, that's it's just a matter of you getting used to it, and for the most part you'll find it's a positive experience.
Linda, we have 2 questions.
Yeah?
A question from Natasha. She says, could you talk a bit about leadership on large teams? There seems to be a wealth of knowledge with large teams, but often some members that contribute or engage less. What kind of expectations would you hold of your team?
That's a wonderful question. And you'll learn over time what you do is you as the lead or co-lead if you're a co-PI on a grant, you have to have these discussions going forward. So it's quite appropriate to say to me, so Linda, how much time can you give and what can I expect out of you? And what do you expect out of me? Because, you know, if somebody's coming on your grant that's a senior person that wants to lead the publications but not do any of the work, then that's not good for you either. So you have those discussions up front, and then you're able to go back and say, hey, Linda, you said that you would actually do these interviews for me, but in fact now it looks like you're backing out. You know, and can you tell me when you can fit them in, or you're not going to be able to? So you do it all up front. At first, these are challenging types of discussions to have, but you do very much need to have the roles clear, and it's a give and take. So you say, and in turn, let me know what your expectations are. And I would say I would caution anybody that wants to take leadership on an output on you, especially if you're more junior, unless there's some special reason why. That's a really good question. And you do need to build into your grants how you're following up with individuals around how they're engaged with you or not. So that was a great question. Looks like there's another question from
Yes,
Stephanie.
we have a question from Stephanie Bailey, and she says, can you please elaborate a bit more about having a patient advisor?
Yeah,
Now,
this was,
Linda,
I had a recent experience myself with that, and it was quite interesting. So I went in for a specific grant competition where it was an expectation of the funder, and it's happening more. And I might have used the wrong language if I used advisor. So some granting agencies or some councils will expect that there's a patient there as an advisor. Some are an actual co-investigator. And the experience I had was that the person was a co-investigator, and I had to have the discussion with them the same as I had with anybody else. That would be an academic person about what I wanted from them, what I expected from them. Would they agree to do this and be that with me? And essentially what we had planned in this study is that as we were talking about what our questions were, that person who had the lived experience with that particular issue was going to help tell us, well, that's not a good question, or you may want to add in this. You know, you may want to look at asking this from a patient perspective. We care about this. And so this particular person wanted to have input right all the way back to clarifying the research questions. And then most particularly, they wanted to be involved at the end part. They wanted to be engaged as we were doing the analysis and writing up and that kind of thing. But they wanted to be engaged in particular in the outputs, because they cared about what would happen, how it would be disseminated to the public or the patient world in the future. And that's huge now in most Canadian dissemination. Writing a manuscript or writing a report isn't good enough anymore. And so we do need to look at more non-traditional forms of dissemination. So those are really good questions. The other types of things you should be considering, I think, are being a reviewer on other people's grants for learning. Ask your colleagues, be ready to get as much input as possible to review your grants. Be a manuscript reviewer. When you go to meetings, don't go back to your hotel room all the time and catch up on work. Network. Go to the meeting, meet people, go up to somebody and said, I saw your scale that you developed on this. It looks wonderful. Tell me more about it. So really work on doing that. Make sure, I'm really reinforcing this a lot, but make sure that when you're trying to go for funding that you're matching the expectations that your faculty or school has. It's not okay to go to a funding agency there's no philanthropist that you likely have in your back pocket, but you really need to make sure that you're above board on this and that everybody's okay. And really seek input from your colleagues to learn about their experiences with a funding agency. I've found for the most part that you'll find colleagues that will share their entire successful grant. You're never going to be able to copy it. All you do is you learn how somebody writes something and pulls it together. And usually getting a recent grant sample is way more relevant than getting one from 10 years ago. And this is very important. Really understand the risks and benefits of following the funding. I do not, and I've never supported anybody going where the money is. That means you're trying to twist your research into what the funding agency said, and you can really cramp your brain that way. It's often not wise to try to twist what you're doing into a particular funding call. If it's easy and it makes sense, that's fine. But don't just suddenly switch over because now there's a funding pod for AIDS research. In terms of outputs, what should your outputs be? I mentioned earlier, it's really important to have publications and knowledge dissemination. That's how your work gets taken up and used by others. The metrics are all about how your citations of your work are taken up and used by others. Is it important where you publish and disseminate? So look for those predatory journals and stay away from them. What does your school or faculty believe about that? It's important to be able to articulate the impact. It's all about the impact of your work. This thing is flying forward and I'm not touching it, I have to tell you. So it's very, very important to do that. Hello there. I don't know who's got the cursor, but...
yeah, it's a bit weird. Hold on 2 seconds.
Yeah, so it's really important. So you should always be able to articulate why this is important. If you ended up in a room where the Minister of Health was at it and you had the opportunity to speak in his or her ear, you want to be able to do that and say, why is there not enough funding for X in Canada? Because this is what's very important to do. So this is pretty much the same, I think. And, you know, it's also very important to have a healthy work-life balance. It sounds like you're doing a lot, but I would really say make sure you build this in. Learn to turn your computer off. Learn to not be on it all the time. Set the time aside to just work on the research, but also make sure you have a balance in your life on the outside as well. You're not, it's not going to be, it's just going skittish here. So you're not going to succeed if you don't have a sort of positive work-life balance. I think we'll just take the last couple of minutes to see if there's any further questions. But we really thank people for what they've come up with so far. But if there's anything further, are there any questions? The last thing I was The last thing I was going to suggest is that you go back to the slide. Just wouldn't go there. Go back to the points you wrote down in the beginning, and based on the discussion, did anything change around what you'd say about your research program? Is it cohesive? Does it have a fit or match to wherever you're working or looking at going? And so just reflect on that. That wasn't a question that we necessarily are saying talk to us about, but you know, in terms of based on this discussion, is there anything you would want to revisit or anything? And then I just had a couple of points here in case is there anything about it that you would want to add? Hopefully the points resonated with you, and if there's any further questions, please just take the last minute or so to ask.
While we wait for that, Linda, I just want to thank you for an excellent presentation. It was really great discussion around the program of research. And so I think we've already had great questions, but if there's any final ones, we'll certainly accept that. Again, it's just been great to have you, Linda, to do this presentation here today. And I thank everyone for your great participation. Thank you for your questions. It's helpful to have those questions to be more engaging. We see a lot of thank yous coming up now, Linda, for your presentation. So
thanks for all your kind work. Oops, that's very nice.
That's great. So please note that after today's webinar, you will receive a short evaluation survey regarding today's session. It should take no more than 5 minutes to complete, and your opinion is greatly valued in planning our future sessions. This recording of this session will be made available on CASN's YouTube channel, and will be circulated to you in the coming days. And feel free to share the link within your network. So thank you again, everyone, and CASN certainly hopes that you will consider attending future Lunch and Learn sessions in the fall. We're planning some for September, October, and November of 2019. And please visit CASN.ca for more information later this spring and to sign up. So thanks again for your participation, and have a wonderful day.
Thanks so much, Nita.
Thank you.
Thank you, Linda and Nita.
Okay, I guess we're signing off now.
Yeah, have a wonderful afternoon.
Great. Thank you, too.
Thanks
Bye.
again, Linda and Julia.
Take care.
Bye.
Bye.